Welcome to our first episode of the Two Med Students, from students for students. I'm happy to be here. Thank you for tuning in. And I'm giving the words to my dear friend Sonny.
So, like David said, my name is Sonny, and beside me I have my dear friend David. And we would like to invite our very first guest to our podcast, Gregor Berger, Mr. Gregor Berger. He is David's father, and he is a psychiatrist, and he's going to tell us more about the field of medicine and what awaits us in the future.
Hi, Sonny. Hi, David. It's a pleasure for me to be your first member in this podcast show, and I very much hope that you will be successful in producing this podcast in the future. So I'm very happy to support you here.
Thank you for being our guinea pig, I guess.
Yeah, our guinea
Thank you. I hope it goes well. Yes. So I think we will dive right in.
Mm-hmm.
So the first question is, how did you end up being a psychiatrist?
Well, already as a teenager, I knew that I wanted to do something with humans. And, well, there are many different options. So I was thinking of studying psychology or medicine, or even I was thinking to become a teacher, or even at some point to study theology. So these are all areas where you interact with people. And then at the end, I realized that medicine is probably a good basis for everything. So that's why I started with medicine.
Mm-hmm. Mm-hmm. Was it always like, you kind of answered this already, but was it always like your dream job as a psychiatrist? Or did you ever want to become like a firefighter or a policeman or something like really stereotypical?
I think my first dream was to become Waisenhausvater. I don't know how to say that in English. Like
orphanage
father, yes. Yeah. Because of a book that I read when I was about 12 or 13, I was very impressed about this person, the main character of this book. But I mean, you can't learn this job. I mean, you first have to learn a profession to become an orphanage director or something like that. And that's the reason why I started to think of what I could do. And myself, I was in a boarding school, and already during this time I taught younger students, and I realized that this was something very satisfactory for me, to be in contact with these younger students and to be a role model. And I think also in sports, I realized that organizing camps and being there for the younger trainees, that was something that fulfilled me. And I think fulfillment is something very important in your profession. Mm-hmm. Because you work for 40 years in your profession, and if you are not fulfilled with what you are doing, then it's sad.
Yeah. I mean, yeah.
Yeah, I also have a quick question right here. What actually is psychiatry? Like, what does it include? Because for me, like you said earlier, psychology comes very close with the wording. Could you say what the difference is maybe between psychiatry and psychology?
Yeah, I mean, there is an overlap when you're working as a psychiatrist between psychology and psychiatry. In fact, the postgraduate training is often together with the clinical psychologists. But the main difference is that if you study medicine, that you have the physical background, so you can be more holistic about the problems of a human who comes to you to get help. So you can look at the physical as well as the psychological part of a problem. Mm. And as a psychologist, your training is more like you understand better the psychological functioning of the brain, whereas as a medical doctor, you are probably more focused on the more neurophysiological and neurological functioning of the brain. Mm. But there's an overlap, and we know today that there's a strong connection between the mind and the body. Mm. And as a medical doctor, you come from the body, and as a psychologist, you probably come more from the development and from the psychosocial influences. But in terms of working, I mean, we are doing a lot of similar things. What we can do and psychologists can't do is that we can do some physical examinations as well, prescribe medication that psychologists can't do. I mean, that's the key difference. On the other hand, psychologists probably are a little bit better in testing and like neuropsychological testing, and their training is more focused on also on the normal development, the normal functioning of the brain, whereas as a psychiatrist you are more focused on the pathological changes associated with different mental illnesses.
Very nice. So what were the hardest decisions in your career that you made as a psychiatrist? Because you worked over 20-30 years in that area.
31 years now.
31 years.
Wow.
Oh,
That is quite an achievement.
When I started as an adult psychiatrist, as a registrar in a general psychiatric hospital in the center of Switzerland. And then I realized that I really liked working with younger people. Like I had 3 patients that were teenagers that were admitted to this ward where I was a registrar, a junior registrar. And then I realized that this work with the families really affected me in a positive way. I really realized that's where you can have an impact. And then I applied for a job at the University of Bern, a combined research clinical job on an early psychosis unit. And I think this decision was probably the most influential decision I made, because I realized that at the bridge between adolescence and young adulthood, a lot of things happen in the life of a person. And that's where I put my focus. It's also called transitional psychiatry. The problem is that the service structure of our mental health service in Switzerland is divided between child and adolescent psychiatry up to 18. And as an adult psychiatrist, you work with people from 18 onwards. And I was interested in this transitional period between 15 and 25. And then I decided to become an adult psychiatrist. And very early in my career, I had the opportunity to go to Australia in one of the leading clinics in the world of transitional psychiatry. And we lived there for 7 years, and I worked there, and I also started my research career in Australia. That was very influential. In Australia, it didn't matter whether I was an adult psychiatrist or a child and adolescent psychiatrist. So when I came back from Australia as a consultant psychiatrist, I had to work in adult psychiatry and realized, wow, I mean, I'm missing the children. And then I decided to become also a child and adolescent psychiatrist. And this was probably the hardest decision in my life, because then I had to step back from a senior role to a more junior role again. And in a way, when you look at it from a career point of view, it was like
kind of a setback.
Yeah, a setback, yeah. But on the other hand, on a personal level, it was a very important experience, yeah.
Yeah, really interesting. And also, I happened around that time, right?
Yes, you were born.
It was a hard decision.
You were born during the time we were in Australia, and you grew up for 1.5 years in Australia. So, I mean, that's the other thing. I mean, the decision to come back to Switzerland or to stay in Australia was also a very difficult decision, because we loved Australia, but we realized that we wanted that our children grow up around their grandparents and in Switzerland. So we came back, and I knew always that this was a one-way ticket coming back after 7 years. And you can always ask, well, was it the right decision or not? I mean, I think it was the right decision for me and for the family to come back. I mean, we had a great life so far, and here, and I could realize a lot of things in the last 15 years. So it was for me very satisfactory what I did. I mean, this since we came back from Australia in 2006.
Yeah, I think also my mother wanted really bad to come back to Switzerland to see her parents. I think that is also a big part in this decision, right? Or
yes, of course. I mean, it's always important. The profession is an important part of your life, but the family is the most important thing. And I think maybe that's the second advice for med students, that they think of how do they want to live in their private life. This decision is easily neglected when you are a medical student, that you focus so much on your career that you neglect other areas of your life that are as important or even more important than your profession.
Mm-hmm.
But it's very hard as a psychiatrist to give the time, right, to separate. I mean, how many hours a week do you work?
I mean, I would like to start at university. It's very hard as a medical student to have a private life beside medical school. I mean, when in the first 3 years, we went to the university at 8 and we came back at 9 o'clock at night, and we just prepared our exams because we had like this. It's different today, but when I studied, you had every year like an exam where everything of the year was tested at once. You know, it was not like you had one course and then you had an exam. So you really had to be prepared, you had to learn a lot in the last 6 months prior to these exams. Elsewise, you would not pass. I mean, there was a failing rate of more than 50%.
Would you say that you had to learn more than we will have to?
I think it's not that different. I mean that
It's still hard,
I think I personally believe the way you do it is better than our way, because it's more natural that you learn a subject and then you finish this subject and then you learn the next subject. I think this is more human. The other thing is more like a selection process. But with your numerus clausus or the medical the entrance exam that you have, I mean, everybody who passes this exam should basically manage to finish medical school. I mean, it's not true. Once you have passed this exam, it's quite at least you can prove that your brain is working. Whether emotionally
true.
You are ready to become a doctor is a different question. I don't think that the selection system is sufficient to select the right doctors, but at least you select people that should be able to accomplish the medical school without breaking down. Let's put it like that. It's from an intellectual point of view, cognitive point of view.
I mean, a little disclaimer: the numerus clausus is an entrance exam for medical studies for the people who don't know, and it's pretty hard, I think.
And it's based on cognitive skills.
Yeah.
It's not like you can study for it, more or less. It's 3D visualization, memorization, more the key elements of learning, not
logic thinking.
But you have to do a preparation course.
Yes.
Otherwise you will fail, because you have to know the way how they test your cognitive capacity. Otherwise you will just fail because you don't know how the test is set up. I mean, I can only recommend everybody to do this preparation course, because I know some very smart people who have failed because they didn't do the preparation course. So really, whatever you do in life, whether it's sports or music or
preparation is important.
You need to train.
But some people, like I knew, like 1 or 2 in our class, who are really, really smart and really talented. They maybe learned like probably like 10 hours or something.
But I mean, those are exceptions, right?
Yeah, these are like, you probably are not one of these persons. Like,
I mean, you could be, but the chances are low.
Yeah,
it's just a thing of probability.
And I think it's also something beautiful to like really sacrifice something in order to gain something that helps you with your dream, right? I mean, I really learned for this test, and I learned really hard. And for a half a year, this was like kind of my life. I did go like to my job, did my training as a volleyball player, then I came back home and I learned like for half a year straight. And looking back on it, like I made good friends with the learning. Like I had a learning group.
We met each other.
Yeah, we met each other. Yeah, that was really funny, and I wouldn't trade for it for anything.
No.
But how many hours do you work in a day or like in a week?
Yeah, that's the
question.
interesting question.
You kind of dodged it, so I'm gonna ask it again.
Well, I mean, you know, David. I mean, I leave the house at 7 o'clock in the morning and I come back around 8:30 to 9 o'clock. I mean, of course, I do not only work. I mean, during the day, I mean, for those who don't know me, I'm the head of the emergency department of the child and adult psychiatric services and the home treatment team and the consular and liaison psychiatric services. So these 3 clinical areas absorb most of my time. And what I really like about this job is the diversity. So on one hand, I see clients with my team together in an emergency situation, but I also manage people. So I see a lot of I mentor people to become psychiatrists and psychologists, clinical psychologists, and I'm also involved in the development of our clinical service, in particular of the home treatment service and the emergency department. And I've done that for more than 11 years. That's very satisfactory. And what I'm missing is the direct clinical contact and the therapy part of my job. Yeah.
Mm-hmm. Mm-hmm. Is everything okay in the background, or thumbs up? Very good, thank you. But for our fellow med students, could you give us a rough estimate what is expected from you as a psychiatrist to work? Like just a rough estimate. I mean, we know
what is expected, what you actually do are 2 different things. I mean,
that is true. I mean, you could just spend 50 hours and do nothing, or invest hours.
Expected
correctly.
is that you work 40, in our clinic it's 45 or 46 hours per week. So 42 hours direct clinical work and 4 hours education. Mm-hmm. In other clinics, it's still 50 hours, but I think they are now in the process to adapt it. So I think once you have finished your medical degree, the expectation will be that you work 42 hours for the clinic that you are employed with, and 4 hours education. So 9 hours a day is expected. Mm-hmm. Okay. But the reality will be different. It won't change, even if the law is there. I mean, the reality will be that you are on call, that you have night shifts, and that there's not enough staff around. So you will be back on the ward at midday, when even after a hard night you will. I mean, but this has improved much. When I was young, we worked like 72 hours in the clinic from Friday night until Sunday night. But today that wouldn't be possible anymore. That's how it was in our time. And I don't think it was better. I think now it's better. It's better for the development of the future doctors. But I think when you work as a registrar and as a consultant, you will work more than 46 hours.
Yeah.
Especially if you do research. I mean, if your aim is to go into private practice, it's probably different. You can manage to work really 42 hours when you are 100% employed. But if you want to do research and do an institutional career, then you probably have to invest more in your spare time.
What do you mean with private practice? What is that?
Well, I mean, they are. I mean, after your med school, you have several options, and a lot of people think that after medical school, most people go into private practice as a general practitioner or as a specialist. But the reality is that more than 50% of the people do different things,
Okay.
So, and before you can go into private practice, that means that you have your own rooms. And as a general practitioner, you see like 30 to 40 patients a day, and you cover the whole area of medicine. But if you are a specialist, like an endocrinologist, then you only treat people who have a problem in endocrinology, or when you are a gastroenterologist, you only see patients with people in the intestine. And so it's really once you have finished your medical degree, you have a 5 to 10 year phase of your life where you become a specialist or a general practitioner. Both is possible. And in this time, you work in an institution, or you go into what we call a Lehrpraxis. So you also can, especially for those who know that they want to go into private practice, it's good. even during training, to have this experience to go to other private practice to learn how to manage such private practice. Especially for general practitioners, it's probably good to do that. So they know what they're expecting once they do that. So, and I recommend everybody not to go into private practice straight after postgraduate training. It's good to work as a consultant for at least 5 years and to take on this responsibility prior to going to a private practice.
Would you say that owning a private practice is like being the owner of a company?
Yes, you have a company when you have a private practice. So either you go by your own, but is not the model of the future. I think the model of the future is that you are a group of practitioners, and especially that share the room, the reception and the waiting rooms and the lab and the pharmacy, so you can optimize the revenue. So so what we call Ärztehaus. So it's probably good if you and then you can also refer patients within the Ärztehaus to your colleagues. What is a very good way, and people from the region you work identify with this Ärztehaus, and they know that there's always somebody around, even if you are on holidays or on leave. There's still somebody around who can have a look at your history and your medication and whatever. So I think that's the future. I think to be in a small private room just by your own, that's probably possible when you go in very rural areas, small cities or small villages in the mountains. But when you are in bigger villages or little cities, it's probably the best to have a group practice with different specialties together.
But I mean, there are always problems with finding like a doctor who is available. Like I went to a dermatologist and I had to wait like 3 months.
Yes.
So if you become a dermatologist, if you just do your own like little practice.
I think that's probably in the moment the biggest challenge, that we don't have enough training positions for medical professionals. So we are still in need to import foreign doctors to provide a sufficient professionals for the whole medical system. Of course, they are working on solutions, but the problem is also it's very costly to become a doctor. So it costs more than 1 million Swiss francs until you have finished your degree.
Yeah. Thanks to our taxpayer, thank you. But yes, that's a problem. I have another question.
I want to answer because we only spoke about private practice so far. I mean, one option is that the aim is that you open up your own private rooms. But I think the other option is that to do an institutional career, so either in academia but also in general hospitals. I think, and this career path is also very interesting because, especially if you like to work in interprofessional teams. And the third career path is something where you are not working with patients, but you work as a medical professional, either in industry or even in medical journals, or there are so many different things you can do with your medical degree, you know. And I have a couple of friends who went into industry and they are doing good money. They earn much more than I do, but that wouldn't be my career path. But I think that's the cool thing about the medical degree. It opens up a wide range of possibilities, and it's important that medical professionals are in different areas, even in politics. I mean, it is important to have medical professionals so that they can influence the way how the medical service system is developed in Switzerland.
Yeah. I mean, the healthcare system, I think it makes about 12 or 13% of our whole like socio-economic finances, like of the BIP, Bruttoinlandprodukt. I don't know how it is called in English. So it's like 1/8 out of every dollar we spend is about in the medical fields. Yes, I mean it's pretty big area of life. and it's also very important. What do you think? I mean, we are studying medicine right now at ETH, so we are also a little bit scared of the future. What will happen? What will happen with AI? What will happen in 2050, 100 years from now with your profession? What do you think will be replaced? Yes.
I mean, I personally believe artificial intelligence will change medicine in a good way, because, I mean, we are all humans, and having technical support, whether it's Google or whether it's artificial intelligence, changes the way we will get information. We will get support from these systems to be more efficient, and also we will be able to use much more data that we could use when I was young. I mean, when I was young, we had only paper and pencil. I mean, this was not always worse, but I mean, even the clinical information system will change. I mean, it will be, I'm sure in 20 years' time, when you are consultants in the hospitals, artificial intelligence will tell you if a patient has, even today it's possible, if a patient has 2 medications that interact, our clinical information system tells us, have you considered this interaction? You know, so, but in 20 years' time, artificial intelligence will do much more. They will, after the entrance examination, artificial intelligence will dig into the much more data and say, oh, this patient had already a complicated operation 15 years ago, and the reason why it was complicated has an impact on the operation that you plan to do. I'm sure that this kind of medicine will change the way you will operate in your daily functioning, and that's a good thing. I don't think that artificial intelligence will replace doctors, but it will complement them in a very positive and good way. The other thing is, and that's particularly true for psychiatry, our diagnostic entities are very artificial entities, you know. Depression is not equal to depression. Autism is not equal to autism. So I believe artificial intelligence will change the way how we will diagnose patients. And we will move more closer to the biology of the deficit or the disorder, and personalize the treatment approaches, not only based on a diagnosis, but much more holistically. So we will consider ethnic and genetic and environmental factors, and also the life history of a patient, to make a choice which is the best treatment for a condition. And today we have very crude, even in internal medicine. I mean, in the past you had cancer, like bladder cancer, and then you treated bladder cancer. But today you have a genetic screening. Already now, you for a lot of cancers, you can already subtype the cancers, and this will influence the choice of the treatment. And I'm sure that this will already be a reality in 20 years' time. And I believe that in 50 years' time, of course, it becomes very speculative when you look at, but in 50 years' time, when you are in my age, no, you are even older.
Even older.
Much older, but I mean, you are already retired, but then you will look back and think, well, what I've done 30 years ago was so crude, and what medicine is doing then is so much more specialized and much more personalized. And I think that will be the future. There will be a lot of challenges, because this type of medicine will be very costly. And we probably won't be able in 50 years onwards to provide treatment to everybody in the same extent. And that are very difficult ethical questions.
Yeah. Regarding the ethical questions, 2 weeks ago we were at the cantonal hospital in Baden, and there we also had like an introduction to AI, just a brief topic. that one of the professors there mentioned. And they showed us an image of a ruptured lung, like an X-ray scan, and also an AI that's still in the beginning phase of its development, and how it was able to identify a pneumothorax diagnosis and other stuff. But what was also mentioned is the ethical dilemma. Like, what if the AI starts to find more diagnoses than there actually needs to be treated? Like, the pneumothorax is an important thing to be treated, but like, what if it finds, I don't know, a small cancer in the lungs that was not even being like known? Like, what to do?
Well, I mean, if you can diagnose a cancer in the lung in a very early stage, you can cure a person. But if you miss the time point, then it's more palliative, you know. Once the cancer has spread across the body, the chance to cure it is very low, you know. And I think if this is possible thanks to AI, it will also be very cost effective. Because as earlier you intervene, as cheaper it will be for society.
Mm-hmm.
The problem is more to know what is the prediction of illness cause. I mean, in cancer it's pretty obvious, but in psychiatry, you know, let's say ADHD, attention deficit disorder, who needs treatment, who does not need treatment, where is the cutoff where you should start medication, where psychosocial intervention is sufficient. These are much more difficult questions because these are dimensions or autism spectrum disorders. At what point the diagnosis is very important so that the patient can be supported to deal with his deficits, but when you give this diagnosis prematurely, it can also be harmful. So I think these are the challenges with artificial intelligence is just very effective in integrating a lot of information, but it does not replace the ethical and emotional part of delivering a diagnosis, or even to decide not to deliver a diagnosis. I think this will be not possible, at least not in the next couple of years, that artificial intelligence will replace these kind of aspects, because they are too complex and involve non-metrical information. And I think that's the key challenge for artificial intelligence. Artificial intelligence is based on data that is available. And data and all the output comes out of this data, and probably at some point artificial intelligence will be better in integrating all the data that's available, but it is not able to capture emotions in the same way as we humans can. And I think that's where I believe humans will not be replaced by artificial intelligence.
Well, I definitely hope so, because if that is not true, we are studying this basically maybe for nothing.
Well, not for nothing. I mean.
But yeah, not for nothing. But a last question on this kind of topics. So you have many touching points with different kind of mental illnesses. Which one do you think is the most interesting? And if you had to choose, which one would you have? Would you like to have? Like, if you had to choose. It's kind of a weird question. But.
First, I mean, as a registrar, I worked for 2.5 years on a specialized unit for emerging psychosis. So the beginning of a schizophrenia or bipolar affective disorder. So, and normally 80% of psychotic disorders start between 15 and 25. So that's that's a lie. Usually that's a chronic condition. And in this condition, early intervention is very crucial to prevent the psychosocial decline associated with the illness. And effective treatment is the key for success. But the problem is that most people stop the treatment prematurely and have relapses. And with every relapse, your likelihood to respond to the same kind of treatment is lower. And for me, psychosis is very fascinating as an illness, because a normal human being starts to change within a couple of weeks or months in a very fundamental way. And you can treat it, and he comes back to his old self. At least after the first episode, it is very likely that you can treat him in a very effective way. So that has influenced me very much. But nowadays, I have to say, as older as I become, I realize that I think every mental illness is in a way fascinating. That's also the reason why I love my job, because it's not only the illness, but it's a human being opposite of you telling his story and how he deals with his deficits in a way, or his worries, and whether it's anxiety disorder or depression, or whether it's personality problems, whether it's autism or ADHD, and it really doesn't matter. I think the key is the relationship between you as a doctor and the patient, and to be able to understand his life and to learn from him what he is suffering from, and to support him to deal with his suffering. I think that's the key element. It's not the diagnosis, it's more the relationship between patient and doctor. And this has changed. In the past, it was like the patient was there and the doctor was there. Today, it's much more collaborative, and you are on the same level. And I try to teach my registrars that you are learning from the patient and not you are teaching the patient. And when you manage to do that, I think then you can really make a difference.
Yeah, very thoughtful. So now we spoke about your career as a whole. Now I want like a different kind of topic, thoughts on society. What did go wrong in the last 10 years? What happened to these youngsters? Well,
I'm very fortunate. I think you turned out quite well.
I hope so. I don't know. We'll see.
In many aspects, you turned out well. Now,
not all.
No, I mean, to be honest, I think already 2,000 years ago, people said, well, we are lost, our youth is, already the Romans and the Greeks said, you can't use the teenagers anymore, but we are still, humans still exist, And I think that's the interesting thing about adolescence. I think you go through some crisis, most of us go through some crisis and manage quite well to overcome this crisis and to become healthy, functioning adults. And that's the good thing. I would say 3/4 of the youngsters will be able to live their lives quite autonomically, and that's something we sometimes forget. Most of the kids manage quite well, and let's say about 20% have difficulties, maybe 25%. Of course, if you look, believe the epidemiological studies, 50% of people have a mental disorder. But if you take, that's probably true, because any addiction is a mental disorder. And if you look at the people who smoke, how many teenagers smoke cigarettes, then you get to these very high numbers. But when you close down on the more severe mental disorders like depression and psychosis and anxiety disorders, then it's probably about 20% that have a treatable disorder. Let's put it like that. And I personally believe that these kind of numbers haven't changed dramatically. There's a couple of exceptions. For until the early 2000s, I think these numbers were quite stable. But in the last 1 or 2 decades, there is indeed an increase in severe mental disorders in teenagers.
Okay.
And that's a very good question to think about what has happened in the last 1 or 2 decades. And there are probably 3 or 4 things that have really changed quite dramatically. One aspect is the family structures have changed. Most people have children in the early 30s today, so so the grandparents are much older, and children grow up under different circumstances than 2 or 3 generations ago. Today, most parents both work, so they are not present, not in the same amount, The education, the early childhood, a lot of the kids, they grow up in foster care situations, whether it's a Spielgruppe or a day mother or whatever. So this is not bad per definition, but it has changed. And the stress for the parents, I personally believe, has become much bigger than, let's say, 100 or 50 years ago. Or not only bigger, it has become better because I think the socio-economic status of most members of the society has improved compared to 100 years ago.
Yeah, for sure. Yeah.
And I think being poor is and was always a bad predictor for mental health already in the past. But still, I think the fact that the family structure has changed makes it harder for young people to have role models. That's one aspect.
Yeah.
The other aspect that I think that has changed, that puberty has become much longer. In the past, puberty kicked in later, so puberty started around 13, 14 and was finished at early 20s, and you had your job and you had children and you worked 40 years in one job. Today, puberty starts 2 or 3 years earlier than 50 years ago, and it goes up to the late 20s until you have achieved all your developmental milestones, becoming independent of your parents, moving out, having your own family and having your profession takes much longer than in the past. And when you think that evolution normally takes a couple of 100 years to achieve that, I mean, that happened all in 2 or 3 generations.
Yeah,
I mean, that's from an evolutionary point of view, that's a second. And I believe our brain is just not ready for what happened in this accelerated developmental revolution of the puberty. I think that's the second large thing that has changed. And the third thing is the digitalization. I mean, when I grew up, we had no smartphones. Yes, and I survived. It's unbelievable, but I survived without smartphones.
Yeah, that's crazy.
And I think the smartphone has a lot of positive things, but it's also, I mean, we had to say, okay, let's meet at 4:00, and we couldn't check whether somebody will be there or not. It was clear that you are there at 4:00 at the point where you agreed on. And today, 10 minutes before you get a WhatsApp, oh, I'm sorry, I can't come, or I'm late, or whatever. Everything is like instant.
Yeah. And
this kind of instant life is putting so much stress on the young people because their frontal lobes are not that much evolved that they can deal with this kind of instant gratification.
Yeah.
And I think that's very harmful for the development. And the other thing is the sleep. I personally believe that the digitalization has reduced our sleep time by 1 or 2 hours in some teenagers by 4 or 5 hours, but the average is 1 or 2 hours. And the sleep during puberty is so detrimental for the normal brain development, and also puts a lot of stress on the young people who are sleep deprived all the time. Because during sleep, your brain reorganizes and the memory formation happens. Even the emotional regulation depends on your sleep. We know today, if you don't sleep enough, that impulsivity is bigger, you have more suicidal thoughts and all that, and that's interconnected. The social media use and sleep and lifestyle is interconnected. When you are gaming 6 or 8 hours, you are not outdoors, you do not meet with real peers, not only virtual peers. You have no hobbies anymore, and
You got no life.
I mean, that's the reality, and it's like a global experiment, and we don't know what's the impact of that, not only on the neurobiological development of the brain, but also on the psychological and social development of a whole generation and our future generations. And one thing that's for me most worrisome is the fact that now the first generation of parents are digital natives. So they have grown up with the handy, and they don't interact with the newborns in the same way as we did, because they are with the trolley and they look on the phone and not on, and they don't communicate with the baby.
Yeah.
You know, and I think that has a huge impact on the social development of a child. You know, because you learn to interact right after birth, you know, probably even during pregnancy, because the unborn child already hears the voice of the mother and the father or whoever. But I think it is so important the first couple of years are so important for the rest of your life. And if your parents interact more with the mobile phone than with their own children, I think that's something that's really worrisome.
Yeah. I don't think we need an experiment to prove that
we don't.
It's detrimental for our development if we do this. Yeah.
I do have a question though. You were saying, so basically you're saying that in today's generation things have gotten a bit harder with social media, with sleep deprivation. When should you consult a person for help regarding these problems? Would you say that today it's more needed to consult somebody?
I think there's no doubt that mental health professionals in general are needed in an unprecedented way. You know, that hasn't been the case since humankind has evolved. I mean, the need for counseling has increased dramatically, and that in particular in the last decade. And we do not have enough mental health professionals, whether psychologists, social workers, or psychiatrists, child and adolescent psychiatrists. There's a huge shortage, and the shortage will become even worse. So, and that's already one of the problems. I mean, at what point should you seek help? Is your question. You should seek help in the moment you are suffering, whatever. So if you are suffering from anything, whether you have problems at school, problems at home, problems with your peers, problems with yourself, in the moment you are suffering for more than, let's say, 2 weeks without a reason, without being able to get support from your family, or not enough support, or not the right support, you should seek help as earlier as better. But it's hard because the waiting lists are enormous. For some kind of disorders, you have to wait close to a year to get the proper assessment. So as early as possible. And I think, but a lot of times you do not realize that you are suffering.
Yeah.
You are angry, you can't sleep, but you have a lot of explanations for that. It's stress at school, or it's stress with your mates, or whatever.
It's medical studies.
Yeah,
medical studies.
No, yes, but you don't realize that you're not happy with your life, or you don't realize that you have experienced something quite traumatic. You know, even after a trauma, a lot of people don't realize that they have experienced a trauma, and even the parents don't realize that their children are depressive, or that they have an anxiety disorder, because as a parent you always normalize the behavior of a child. And then things are delayed, and people lose track, because I think the point where parents should react is when a child or a teenager drops out of his normal development. And not only at school, also when he stops his hobbies and doesn't see his friends anymore, withdraws socially. You know, I mean, to some extent, this can be normal during puberty that you don't want to talk to your parents. But if you don't want to talk to your peers anymore, that's worrisome. You know, then you should react. Or if your child is crying all the time, you know, I mean, a lot of kids tell me, they come to emergency department and tell me, you know, for the last year, there hasn't been one day that I haven't cried, you know. I mean, that's very sad that then they don't get help earlier. Why do they need to cry for a year on a daily basis without getting help? You know? I mean, if you crying is not a mental illness. There are many reasons why you can cry, because you are disappointed. But crying on a daily basis or most of the days of a week, then you should get help. Having a sleepless night is not worrisome, but having 5 sleepless nights in a week, that's worrisome, you know. Having a drop in your school performance for 1 or 2 weeks, having bad marks, that's not, most people have that at some point, but having bad marks for 3 months, I mean, then you should start to try to understand what happened. You know, if there's a change in your life trajectory, then you should respond.
I've got a question, like from a psychiatric standpoint, what is the right age to give your child a phone? Because I think that's some sort, for me, you give me a phone, like I think when I was 13, right?
Yes.
And for me it was like, I always wanted a phone, you know. I think annually, every Christmas I said, Dad, please give me a phone.
And I was such a bad dad.
Yeah, really bad.
A specific phone or a specific phone, like an iPhone?
No, I didn't really care. It could have been
Nokia.
I didn't care. But I just wanted a phone that I could be cool, you know, in front of my peers. You know?
I get it.
You would have a phone.
Yeah.
So I think you were the second last in your class.
Yeah.
Getting a phone.
But like in hindsight, I'm grateful because I knew if I had gotten a phone like this early, I would have been done for, you know. Like, I mean, I'm such a addictive character. Like it's crazy. So I can't handle this type of stimulus, you know.
Yeah.
But what is the right age? Like, would you say for the average person?
I think the key problem with the smartphones is, you know, I'm talking about smartphones. I'm not talking about the Nokia, you know, that's the difference. When you get the Nokia to a child who travels for 1 hour to his training or whatever, that's something different. Because with the Nokia, you can speak on the phone and nothing else, you know. With an old Nokia. With an old Nokia,
Nokias can
yes,
also
of course. But we are talking about smartphones. The smartphones today, the programs, the apps like TikTok and Snap and Insta, they are highly addictive. And the brain of children are not ready to deal with this type of algorithms that lie behind stimulus. Yes. So I personally believe puberty is probably the right age to get in contact with smartphones. So let's say 12, 13, 14, around that. So in primary school, I personally think neither a computer nor a smartphone should be used.
Yeah,
that's my because the brain, the frontal lobe, is not enough strong at that point to deal with all these stimuli. The problem is the reality today. Grade 4, half of the class already has a smartphone, and they interact with each other over the smartphone. And if you prohibit your child to be part of that, at some point it becomes harmful for the child. So it is a challenge to find the right balance. It's probably not about, the question is probably not the right question. What is the right age for a smartphone? So the question would be, how much of a smartphone and how much control is taken over by the parents in young children? I think that's the key question, because I think I compared, like, if you would go to your best friends at the age of 12 and you would see that there's a bong on the night table of your friend, you would think, well, what's strange? I don't go to this place anymore.
No worry.
But if there's a smartphone on the night table beside the bed, you say, okay, that's normal. But the addictiveness of a smartphone at the age of 10 or at the age of 8 is probably higher. I mean, it's because I've seen 8, 9, 10 years olds that had a gaming disorder. Nothing else was interesting more in their life except of gaming.
Yeah.
They were highly addicted. And it's one of the hardest things to treat a gaming disorder, or in females it's not the gaming, it's more like the social media addiction. And there's not an official diagnosis yet, but there will be one in the next couple of years, because that's a huge problem. They spend 14 hours, 16 hours besides school.
Or inside school.
Or inside
during
school.
yeah.
During school. On social media. And it's not the social media itself that's so harmful, but it's what's so harmful that they neglect other things in their life, you know.
Mm-hmm.
I mean, they neglect talking to their friends in real, you know, having conflicts and resolving conflicts, because they are online all the time. Mm-hmm. And it's so easy to delve into this virtual world, and it's so hard, it's so painful to be in the real world and to be excluded and to deal with this kind of exclusion. But that's what you need to learn when you are young.
Yeah. When
you don't learn it as a young person, you won't be able to learn it as an adult.
Mm-hmm. I mean, I have played with the thought of giving like an age restriction on the phone, that we don't have the problem of, all my friends have a phone, I'm being left out, because that causes also harm. But I don't know if we can like set this through. Because
I mean, Australia, they are trying that right now. Yeah. China also has started.
But China's a different story.
I mean, China,
India as
Australia, well. Australia is now trying to limit access to social media, depending on what social media, between 14 and 16. And that's probably a good move, because that's when your brain starts to become in control, and the awareness of yourself becomes much more conscious than before the age of... I mean, you probably don't remember how you were at the age of 10, because your frontal lobe... I mean, you have probably memories, but they are memories from photographs and memories because they were very special events. But the way you acted as a 10-year-old, it's hard to tell about your early childhood, your primary school, but it's not hard to tell about your year 8 to 9, because you still can remember what you did there. And that's the frontal lobe. Your self-awareness becomes stronger at the age of 13, 14, 15. That's where you develop your own identity, and that's where you can learn to deal with social media. And of course, you remember at this age you were crashing 2 or 3 mobile phones or making holes in the wall because you lost on
God damn.
I mean, and that was age appropriate, I would say. But if
I don't know if that was age appropriate.
But when you would do that now, I would be very concerned. At this age, I was also a little bit concerned, but it was okay. You know, it was age appropriate behavior. And I think maybe it was 2 years too early to give you a smartphone where you could play Fortnite or whatever you played. But it was the way it is, you know. And you learn to deal with it, you know. And we had discussion, you know. The most important thing is we spoke about it all the time. We thought about it, you know. But there are a lot of families that they have no rules around it. You know? And that's the problem. How do you get in touch with those families where both parents have to work 10 hours and they have 2 jobs and to get enough money to live in Switzerland? And I think these families are the challenge, you know.
Mm-hmm. So to our next question. So we really talked really negative about our generation, but now it's about time to end maybe on a positive note. So what are, like, just summarize 3 musts to live a healthy life as a teen, as an adult, as a human being,
As a med student.
as a med student, because that's also difficult. What do you think? What are the three most important factors here? Like,
Well, I really love this question because I think that's where parents and also teenagers and students should focus on. I think a healthy lifestyle is extremely important. But what does it mean to have a healthy lifestyle? I mean, I think to be around the right people is something important, you know. Also to have people that share interests that you have is important. And that you go along with quite well. So I think that's a very protective relationships is a key protective factor for your mental health. And it is worth to invest into relationships. Not only romantic relationships, but also friendships, true friendships that carry you through your life. I think that's a very protective factor.
platonic friendships.
Yes. So the other one is sports. Sports is proven to be antidepressive and is just it's a healthy way of interact with people. Normally you do sports with friends, you know, so you have both at once. And 3 times, I always say when I see clients say, what kind of hobbies do you have? And if somebody has no hobbies, I think it's always an aim in my therapy that he develops a hobby. It doesn't have to be sport, but sport has the advantage that it releases hormones in your body that make you happy, you know. And from this point of view, I think having, whether it's dancing or whether it's volleyball or whether it's running, it doesn't matter. But as long as you sweat 3 times a week for more than half an hour, it's okay. And the fourth aspect that I believe is very crucial is that you have a sense of your life, you know, having a sense, whether it's medical school or whether it's being a trainer at the rowing club or whether it's working in a foster care unit or whatever. It doesn't matter, but you have to identify with what you do. If you do something you don't love, it is hard, you know, 8 hours a day to do something you don't love. So it's really important to find something that you love. And the question is, how do you find it? And this is also a question of experimenting and being open and having also people that you can look up to and see, okay, this person lives a life that I would like to live myself. To having role models and to go into this direction. I think that's something very helpful. And nowadays it's sometimes, I believe I had a lot of role models when I was a teenager, and today your role models are virtual role models. They are not, can't touch them, they are virtual. And the problem is having virtual role models is you can't get there, you know. There are very few influencers that have 1 million followers, you know. But having a role model in your neighborhood who is a carpenter and he loves what he's doing and you love wood and you want to become a carpenter, you know, that's much more concrete, you know. Or having a friend in your class who does sport and you realize, oh, he's a good boy, he's a good man, and then joining him, you know. That's, I think these kind of role models, they are real role models. And I think that's so important to find these kind of people in your life. They are, I think that these are the 3 aspects I would say I would prioritize.
And as a parent, did you try and integrate these aspects into David's life?
Yes, I tried to convince him to start rowing. I failed completely.
I did for a year or 2. I know it was not bad, but it wasn't really fun, I guess.
Yes, yeah. I think having a group sport is much more like volleyball is much more interesting, especially for somebody like David who needs this kind of challenge. But there are other persons who love doing endurance sports, and then rowing might be a better option. I think everybody has to find his way, and I'm so glad that I think all my kids found in a way a hobby, not only sports, but where they can identify with, and I think that's the important thing.
Mm-hmm. So now there's a little last segment where I do want to interview you, not as a psychiatrist, not as a doctor, but as a dad, because that's also a very important part of your life. I hope so. So would you do anything different in my upbringing? And if so, what?
Well, David, that's a very personal question. I think I sometimes failed a little bit because I was not present enough. Mm-hmm. That's when I'm very self-critical about it. I work too much in a way. I think that's what I would do different today. Maybe I was a little bit too ambitious in my early career. Now I know I was too ambitious, and it was not very fruitful from time to time to be so ambitious. But I think that's something that it was not a conscious choice. I was so driven in doing what I did, and maybe my passion for my profession, I think I can see my passion that I have in yourself and also in your sisters. And I think being passionate about something is also something nice, but it has its price, I think when we were in Australia, I was much more present. I think your early childhood, I was more present than with the other 3 kids. Mm-hmm. Because when I came back, I worked probably more hours than in Australia, because the lifestyle in Australia was so different. You started work at 9 and you stopped normally at 6 or 7. And Sonia, my wife, she was a nurse, so she had a lot of late shifts. So I could work when she had late shift. I worked until 10. But when she had no late shift, we went out for the movies at 6 o'clock. It was or we went out having dinner together. So it was much more intensive when we had no children, our life. And then afterwards, once the children were there, it was intensive in a different way. We were very challenged by the sleepless nights and being a parent and learning this new role. But it still worked, and it was more than okay. It was very satisfactory. But coming back to Switzerland and then having Rachel and the twins, and so it became like we started to function as parents, and also in my work I had to function, and I think maybe I was not enough conscious about what I missed because I worked so much, and I think that's what I would do different. Maybe not write today I think I did some projects that didn't make a huge impact. So I think, well, maybe I should focus more on the clinical work and less on the project work that I did in the past. But in retrospect, you are always smarter, and it was important to do what I did. And but the focus should lie more on your family, I think. As a parent, both parents should find the right balance. And
yeah, good answer, I think. Yeah, I would agree.
What do you think? What would you have liked from your father?
I think you did a fantastic job. But I mean, for me, I think we had like many days where we just were alone, we two, and we did like go to the movies and stuff. Like we had like some father-son quality time.
Yes.
And I think with me, that you weren't always 100% there, it wasn't, I don't know, not that hard for me. I think for my sisters, it was a different story.
And for Sonia too.
But me, I don't know. Maybe it's just because I'm a man. I don't know. I don't know. Maybe I always had a good relationship, I think, with you. So the time we spent together, I think it was really good quality time. So I didn't really care that you were not here 24/7. And if I needed something, you were always there. I think that's also important to say. I have a last question to sum this up. Do you have like any core memory with me or with the family that you want to share? Like something that pops into mind, like a proud moment or... Anything?
Well, I have so many memories. I don't know which one to share. I mean, when you were born, this was a miracle for me. I mean, and that, really, I mean, to have you this little thing on my arm. And I remember the first thing you did, you peed on me. I mean, but it was so okay. I mean, just
the casual.
I mean, I knew, in this moment, I knew that having a family is the most important thing. I think that was the key experience for me. But there were so many funny things. I mean, in Australia, but also in Switzerland. I mean, and I'm just very proud, I mean, as a father, that I have 4 children that are all so good and interesting and lovable, you know. I mean, that's a gift, you know, because I see a lot of families where the relationship between the children and parents are so tensed, and I think we also have our fights, but in general, we know that we are here for each other at any time, even if there are fights, and I think that's the key of being a family. And Sonia and I, we are still together after more than 26 years.
That's a miracle.
I mean, whoa!
And that's
just kidding.
It's, and I think that's I'm very humble, and that this I mean that this was possible, you know. That's because 50% of the marriages break, or now it's about 40. In the past it was 50, but a lot of marriages don't survive, and I think we that's I'm very grateful that our family is the way it is.
Yeah, I think that's a good way to end.
A beautiful ending. Yeah,
beautiful ending. So, you want to do that, or should I do that?
Well, first I would like to thank you for coming on our first episode. It was a very nice episode, in my opinion. And maybe if time permits in the future, I would love to have another podcast. Maybe we could go more further into your relationship instead of just cutting it down. So in the end, but I think. Do you have any final words, or you?
Yeah, that was it. Thank you for tuning in.
Yeah,
if you made this far, crazy. I don't know how you did this. No.
But stay tuned for further episodes and for the next episode with Mr. Berger.
That was the podcast of the 2 med students.
Yeah.
From students for students.
We hope you enjoyed it, and we hope to see you soon.
Yeah.